CEN Test Prep Exam Review. Question 1. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects option A, open-angle glaucoma, option B, acute angle-closure glaucoma, option C, a conjunctivitis, option D, uveitis. The correct answer is option B, acute angle-closure glaucoma. Question 2. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer option A, folic acid, option B, a vitamin B12, option C, thiamine, option D, magnesium sulfate. The correct answer is option C, thiamine. Question 3. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A, EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, PtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates option A, allergic rhinitis, option B, nasal mucosal secretions, option C, CSF leak, rhinorrhea, option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. Question 5. The most common cause of acute renal failure in hospitalized patients is option A, glomerulonephritis, option B, acute tubular necrosis, option C, renal calculi, option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. Question 6. The safe harbor provision for nurses typically refers to option A, a law that provides legal immunity in all circumstances, option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation, option C, a hospital policy allowing nurses to refuse any assignment, option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 7. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects option A, hemorrhagic shock, option B, neurogenic shock, option C, cardiogenic shock, option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Question 8. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates option A, a damage above the midbrain, option B, a damage at or below the midbrain/brainstem, option C, damage to the cerebral cortex, option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as option A, Gray-Turner's sign, option B, Cullen's sign, option C, Murphy's sign, option D, Rovsing's sign. The correct answer is option B, Cullen's sign. Question 10. In distributive shock, the primary pathophysiology is option A, pump failure, option B, widespread vasodilation and increased capillary permeability, option C, fluid volume loss, option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Question 11. The antidote for benzodiazepine overdose is option A naloxone, option B flumazenol, option C N-acetylcysteine, option D atropine. The correct answer is option B, flumazenol. Question 12. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. Question 13. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression. Option B, dry skin and absent bowel sounds. Option C, hyperreflexia, clonus, and agitation. Option D, bradycardia and hypotension. The correct answer is option C, hyperreflexia, clonus, and agitation. Question 14. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts, option B, pregnancy status, option C, endometriosis, option D, PID. The correct answer is option B, pregnancy status. Question 15. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. Question 16. A patient leaving against medical advice, AMA, must be informed of option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. Question 17. The hallmark sign of compartment syndrome is option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Question 18. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive fluid resuscitation. Question 20. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should option A, stop the nitroglycerin infusion immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option C, treat the headache and continue nitroglycerin as ordered. Question 21. Testicular torsion is a surgical emergency that requires intervention within option A, 24 hours. Option B, 4-6 hours. Option C, 2-3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours. Question 22. Pulsus paradoxus is a classic finding in which condition? Option A, cardiac tamponade. Option B, pulmonary embolism. Option C, aortic aneurysm. Option D, congestive heart failure. The correct answer is option A, cardiac tamponade. Question 23. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, U.S. citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. Question 24. A patient presents with cholinergic symptoms, salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option C, cholinergics, organophosphates. Question 25. The purpose of administering surfactant to a patient with ARDS is to option A, bronchodilate the airways. Option B, reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis.